Welcome to part 3 of ECG Made Simple. In this video we will cover cardiac intervals. Let's start by talking about the sequence of electrical activation in a normal heart. So the cardiac cycle begins with an impulse generation at the sinus atrial node, which then propagates through the atria towards the atrioventricular node, producing atrial depolarization or activation. This electrical activity forms the P wave on the ECG. The impulse then pauses at the AV node, which function as a checkpoint to ensure complete atrial contraction and proper emptying of blood into the ventricle. This delay appears on the ECG as the PR segment, which is a flat line with no recorded electrical activity. After this delay, ventricular activation proceeds rapidly through the bundle branches and Purkinje fibers, generating the QRS complex. The QRS complex has 3 sequential phases. First, the septal activation or depolarization, which occurs from left to right, producing a small Q wave in the left-sided leads. This is followed by depolarization of the left ventricular free wall, which is the bulk of the ventricle, and that creates the tall R wave. Late activation of the basal and posterior region generate the S wave with the vector opposite to the main direction. After the QRS complex completes, the ventricle remains fully depolarized and contracted for approximately 100 milliseconds. During this period, there is no electrical activity on the ECG, and this is represented by the ST segment. After the ST segment, ventricular relaxation begins. This produces the T wave, which normally points in the same direction as the QRS complex. Interesting fact, the large muscle mass of the ventricles explain why the QRS complex has a much higher amplitude than the P wave, which is generated by a smaller atrial muscle mass. Also, atrial depolarization occurs but during the PR segment, but it's not visible on the surface ECG. This is due to the small atrial muscle mass and overlap with the much larger ventricular depolarization signal.